You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about gentle cesarean and evidence-based options for a family-centered birth. This involves adjustments that shift a cesarean from a standard surgical procedure to a more personal, connected birth experience. As cesarean births have become more common, the options that are available to you have expanded significantly. However, options only matter if you know that they exist. If you don't know what you can ask for, you can't advocate for it, especially when it comes to options that may not be part of your care provider's routine standard of care. This episode will walk through every modification, from clear drapes to immediate skin-to-skin contact to a slower delivery and delayed cord clamping. We'll also take a deep dive into research on vaginal seeding and what it means for your baby's microbiome. Whether you are planning a cesarean or preparing a backup plan, understanding these options will give you the tools to advocate for the birth experience that you want. You can see the full article and all of the resources for this episode at pregnancypodcast.com/gentle cesarean. You are on the public feed of the podcast, which gives you access to the last year of episodes. There are hundreds of episodes with evidence-based information that you won't find anywhere but the premium feed. Become a Pregnancy Podcast Premium member, get access to every single episode of the podcast, and all of the content is ad-free. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. From skincare to treating common symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics has you covered. They make amazing 100% clean, natural pregnancy products. Plus, everything from 8 Sheep comes with a 100-day happiness guarantee. Try it risk-free, and if you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things you can do to support your body every day. Head to drinkag1.com/pregnancypodcast, and when you first subscribe, you'll get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1. Go to drinkag1.com/pregnancypodcast. A cesarean section is a surgical procedure that delivers a baby through incisions in the abdomen and the uterus. In the United States, about 1 in 3 babies is born this way. If you have not yet listened to the episode on what to expect in a cesarean birth, that episode covers everything from why cesareans happen to the procedure step by step, through recovery, and what it means for future pregnancies. This episode builds on that foundation. So if you're listening to this first because you know you want a cesarean and you want to understand your options to make it more family-centered, you're in the right place. We'll cover enough in today's episode that you can follow along, but I do encourage you to go back and listen to what to expect in a cesarean birth episode so that you have the full picture, including all your anesthesia options, types of incisions, and detailed guidance for recovery. A gentle cesarean involves modifications to the standard procedure. This is to make the experience more centered on you and your baby. You may also hear this referred to as a family-centered cesarean, a natural cesarean, or a family-centered birth. There's no single definition of what constitutes a gentle cesarean. It's really a collection of options that you can choose from depending on your preferences and what your hospital or care provider supports. The core idea here is simple. A standard cesarean prioritizes the surgical procedure. A gentle cesarean prioritizes the birth experience while still maintaining safety. There's not a single modification that defines a gentle cesarean. It's the combination of these changes that transforms the experience from more of a surgical procedure into something that may feel more like a birth. This includes changes to the operating room environment, how interventions are handled, how your baby is actually delivered, and what happens immediately after birth. Research consistently shows that the environment that you give birth in has a real impact on your experience. A Cochrane review of 10 trials that involved nearly 12,000 women found that birth settings that were designed to feel less clinical were associated with lower intervention rates and higher satisfaction. While an operating room is a lot more constrained than a labor room is, the same principle applies. The more comfortable and in control that you feel, the better your experience is likely to be. Operating rooms are sterile by design. They're cold, brightly lit. You may smell cleaning products. You may not have a lot of control over those things, but you can make adjustments. One option is to play your own music during the procedure. This may seem like a small thing, but sound can have a powerful impact on how you feel. A systematic review and meta-analysis published in the American Journal of Obstetrics and Gynecology found that music significantly reduces anxiety in women undergoing cesarean delivery. A 2023 systematic review of 28 randomized controlled trials on music during both vaginal and cesarean birth found that most studies report reduced anxiety and pain. Familiar music can really shift the energy of the room and help you feel more grounded. I mentioned that you may smell cleaning products. If scent is something that helps you feel calm, aromatherapy may be another option. A systematic review of 33 studies found that aromatherapy, most commonly with lavender essential oils, reduced both pain and anxiety during labor. A 2023 meta-analysis of 14 randomized controlled trials confirmed that aromatherapy significantly reduced labor pain. Another randomized controlled trial found that lavender aromatherapy after a cesarean reduced both pain and anxiety. An operating room, again, different than a labor room, so it's unlikely that you would be able to use a diffuser in an OR, but this is something you could potentially incorporate afterwards. You can also request that unnecessary lights be dimmed. Of course, primary surgical lights will have to be on so that your doctor can see clearly. That's important. You can also ask that doctors and nurses keep conversations focused on you and your baby. Your birth is one of the most significant moments of your life, and you should be able to be present for it without being distracted by unnecessary bright lights and doctors talking shop. If you have a planned cesarean, some hospitals will let you visit the operating room before your surgery date. The idea is that that space will feel less intimidating if you've seen it before. This may not be available at all hospitals, but it's worth asking about. Another meaningful change is meeting the obstetrician that will perform your surgery ahead of time. Of course, you would think that your primary doctor would be the one doing your surgery, and hopefully that's the case. In many hospitals, the doctor on call is the one who performs the cesarean, which means that you could be meeting them for the first time just minutes before your surgery. Ideally, it's your own obstetrician that's present, because that continuity of care can make a big difference in how you experience your birth. Next, let's talk about support people in the operating room. ORs have limited space, and most hospitals only allow one support person during a cesarean, and usually that's your partner. Your partner plays an active role here, Most importantly, they are next to you, they're right by your side, and they're there to support you. In a gentle cesarean, you may be able to request an additional person. This could be a friend or a family member for emotional support. It could be someone you hire, like a doula or a photographer. A doula can help you stay calm, remind your care team of your preferences, and provide comfort by holding your hand or talking you through the process. Having someone in the room whose sole focus is supporting you emotionally, rather than just being there on the medical side, can really transform the experience. If photography or video is important to you, ask your care provider about the policies of the hospital. Many families like to document the moment that they meet their baby, even if that's happening in an OR. That is a fleeting moment that you cannot recreate. So if you're interested in having a photographer present, talk to your doctor and find out if that's a possibility. Every provider, every hospital has standard procedures for how a cesarean is performed. And over time, many of these have evolved. Adjustments are slowly being incorporated to prioritize the experience of the mom and baby alongside all of the needs of the surgical team. Some hospitals have already adopted elements of a gentle cesarean into their routine protocols. Others will still require a specific request. The key is to ask your care provider ahead of time what their routine practice is so that you know what you need to advocate for. In a conventional cesarean, your arms are positioned out to your sides and they're secured on arm boards. This gives doctors and nurses easy access to veins and medication portals. In a gentle cesarean, your arms are free so that you can freely move them and so you can hold your baby. A pulse oximeter that measures oxygen saturation in your blood is placed on your foot instead of your finger in a gentle cesarean. It's a small change, but it means that there is one less thing attached to your hands, so it's easier for you to hold your baby once they arrive. IVs should be placed on your non-dominant arm. So if you're right-handed, then the IV goes on your left arm so that you can hold your baby with your stronger hand. Same applies to things like blood pressure cuffs. An EKG, which is used to monitor your heart, typically has leads that are attached to your chest. In a gentle cesarean, those leads are repositioned to the side, which leaves your chest clear of wires so that your baby has direct skin-to-skin contact when they're placed on your chest. Each of these adjustments is small on its own, but together they can make a big difference. In a standard cesarean, you have an opaque, sterile cloth that hangs about at the level of your chest, and that blocks your view of the surgery. Everything on the other side of that is the sterile field. A gentle cesarean replaces that opaque cloth with a clear plastic drape. The clear portion of the drape is positioned so that you can see your baby as they emerge, but it still hides the incision and the surgical field so that you're not seeing that. Your doctor will typically adjust the drape at the moment of birth so that you can watch. If a clear drape is not an option at your hospital, you can ask that the opaque drape be lowered at the moment your baby's born. Even a brief view of your baby emerging can make the experience feel more like a birth and less like a procedure. For many moms, this is one of the most meaningful modifications in a gentle cesarean. In a conventional cesarean, you hear your baby before you see them. And then someone else, a nurse, a doctor, is going to see your baby first. They'll announce the birth. When you have a clear drape, you're witnessing that moment yourself. So it potentially can shift your perspective from being more of a passive observer to feeling more like an active participant. In a conventional cesarean, once the uterine incision is made, the doctor delivers your baby relatively quickly. A gentle cesarean slows this process down. Your doctor assists your baby's head out first. Once the head emerges, your baby can breathe through their nose and mouth while they're still attached to the placenta and receiving oxygen through the umbilical cord. Rather than pulling your baby out right away, the doctor waits while pressure from your uterus helps expel fluid from the lungs. This mimics what happens during a vaginal birth, where the vaginal canal naturally squeezes fluids from your baby's lungs as they pass through. Respiratory issues are more common in cesarean-born babies, and that's partly because of that natural compression which isn't happening. A slower delivery could potentially help reduce that risk. Once your baby cries, the doctor eases out the shoulders, and then the rest of the body follows gently. With a clear or a lowered drape, you can watch this entire process unfold. This approach was first described in a 2008 paper in the British Journal of Obstetrics and Gynecology as the natural cesarean technique. The original researchers described this process as autoresuscitation, where the baby begins breathing while the body is still partially in the uterus and supported by placental circulation. Immediate skin-to-skin contact is one of the most important elements of a gentle cesarean. In a standard C-section, the baby is typically passed to a nurse for an evaluation before you get to hold them. In a gentle cesarean, your baby goes directly onto your chest as soon as possible after birth. The research strongly supports this practice. A review found that immediate or early skin-to-skin contact after a cesarean may increase breastfeeding initiation, decrease the time to first breastfeeding, reduce formula supplementation in the hospital, increase bonding and maternal satisfaction, maintain newborn temperature, and reduce newborn stress. Another review that analyzed data from over 2,000 births found that skin-to-skin contact was associated with fewer neonatal intensive care unit transfers. A study that directly compared skin-to-skin cesarean with a conventional cesarean found that fewer babies in the skin-to-skin group were admitted to the pediatric ward and fewer had suspected infections. Plus, there was no significant difference in maternal outcomes, and the procedure took only about 5 minutes longer. You spend most of the time in the OR after your baby arrives, while your doctor is closing up incisions. Having your baby on your chest during that time gives you extended skin-to-skin contact and allows you to start breastfeeding in the operating room. If you're unable to hold your baby, your partner should be able to step in and provide skin-to-skin as early as possible. When your partner provides skin-to-skin contact, your baby receives many of the same benefits. This includes temperature regulation, stabilized heart rate, and reduced stress. Skin-to-skin with a partner also supports early bonding between your partner and your baby. A gentle cesarean really prioritizes keeping you and your baby together from the moment of birth. So that starts with immediate skin-to-skin and then continues into recovery. You can request that your baby stays with you when you're moved from the OR to recovery. Many routine procedures with your baby take place without them being on your chest. And that has a lot more to do with convenience for providers and nurses than with the purpose of supporting you in bonding with your newborn. Assessments like checking your baby's reflexes, listening to their heart and lungs, assigning APGAR scores, those can often be done while your baby is skin-to-skin. If you opt into procedures like administering vitamin K or erythromycin eye ointment, there's no reason that your baby needs to be away from you while those are administered. Other procedures, like weighing your baby and measuring their length, can also wait. There is substantial evidence supporting the prioritization of uninterrupted time with your newborn, especially in the first hour after birth. There's a reason that is called the golden hour. It may seem like a good idea to bathe your baby, especially if they're born with a lot of vernix. This is a white cheese-like coating that protects their skin in the womb. Babies that are born via cesarean tend to have more vernix because it's not getting wiped away in the vaginal canal. There's no medical reason to bathe your baby immediately, and delaying it gives you more uninterrupted time together. Plus, that allows vernix to absorb naturally, which may have some benefits. The takeaway is to discuss with your care team which procedures can be done at your side and which ones you want to delay. Just because a procedure is routine does not mean that you have to accept it without question. You always have the right to ask what can be adjusted, delayed, or done differently. Delayed cord clamping is a common component of a gentle cesarean, and it's supported by strong evidence. The American College of Obstetricians and Gynecologists recommends delaying umbilical cord clamping for at least 30 to 60 seconds after birth. Benefits include increased blood volume, improved iron stores, reduced need for blood transfusion, decreased incidence of intracranial hemorrhage in preterm infants, and lower rates of iron deficiency anemia. A longer duration of placental transfusion can also benefit your baby, and that's because blood contains immunoglobulins and stem cells. ACOG notes that in a cesarean delivery, the newborn can be placed on your abdomen or held by the surgeon at a close level to the placenta until the cord is clamped. You can request to delay longer than 60 seconds. Some parents ask to wait until the cord stops pulsating. That can take several minutes. The idea behind waiting longer is to maximize placental transfusion. That's the transfer of blood from the placenta to your baby. Research suggests that a longer delay may increase the volume of blood that your baby receives. ACOG's updated guidance on preterm infants notes that longer deferrals of 120 seconds or more were associated with an even greater reduction in neonatal mortality. ACOG states that for term infants, the optimal length of delay beyond 60 seconds is less well studied, but there's no evidence that a longer delay causes harm. Talk to your care provider about what they're comfortable with and what options are realistic in your specific situation. I do have a full episode that goes into a lot of detail on delayed cord clamping. Also, keep in mind that if you're considering cord blood banking, there's an episode on that I encourage you to listen to. And you need to know that it may be challenging to both delay cord clamping and bank cord blood. So you need to discuss that with your care provider. Next, we'll talk about more modifications that you can make and discuss vaginal seeding. Before we do that, I would like to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things that you can do to support your body every day. AG1 goes to great lengths to continuously invest in rigorous peer-reviewed clinical trials. You know how much I love research. AG1 goes above and beyond to test for hundreds of contaminants and impurities to guarantee that they deliver the highest quality nutrients available. I've been starting every morning with AG1 for years, and I really love the peace of mind knowing that I'm covering all of the key nutrients that my body needs. Plus, I'm supporting my microbiome, metabolism, and my immune system. Head to drinkag1.com/pregnancypodcast, and when you first subscribe to AG1, you'll get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1. Go to drinkag1.com/pregnancypodcast. As a friendly reminder, pregnant or nursing women should seek professional medical advice before taking this or any other dietary supplement. Let's get back to today's episode. When a baby is born vaginally, they're exposed to bacteria in the vaginal canal. This exposure helps populate the baby's skin, mouth, and gut with beneficial bacteria that supports immune development. A baby that's born via cesarean doesn't get that same exposure. Instead, their first bacteria tend to come from the skin and the hospital environment. Vaginal seeding is a practice that aims to bridge that gap. It involves swabbing a cesarean-born baby with gauze that was placed in the mother's vagina before surgery. That may sound like a crazy idea, but let's talk about it. Research on vaginal seeding has progressed significantly in recent years. The earliest study was in 2010, and that compared bacterial profiles between babies that were born vaginally and those born via cesarean. Babies that were born vaginally had bacteria communities resembling their mother's vaginal microbiota, while cesarean-born babies had communities more resembling skin bacteria. This study was very small. It was just 9 babies, and the mothers who received cesareans also received antibiotics. However, it did open the door to an important area of research. A follow-up study tested whether vaginal bacteria could be transferred to C-section babies using a gauze swab. Researchers placed sterile gauze in the mother's vagina before surgery and then used it to swab the baby's mouth, face, and body after birth. The swabbed babies had bacteria profiles that were much more similar to vaginally born babies than to other cesarean-born babies. Since then, the evidence has continued to grow. A 2023 randomized controlled trial showed that vaginal seeding increased beneficial lactobacillus bacteria in infant stool, and researchers did note, though, that repeated doses might be needed for lasting effects. Another blinded randomized controlled trial of 68 infants found that babies who received vaginal seeding scored significantly higher on neurodevelopment assessments at 6 months compared to those who received a saline control. A 2024 systematic review summarized 8 studies involving 558 cesarean-born babies. The review found that vaginal seeding produces modest changes in the gut microbiome, particularly restoring key microbial communities. However, it does not fully replicate natural microbial transfer at birth, and importantly, they noted across all studies reviewed, none of the infants experienced any serious adverse events. ACOG's official position on this was published in 2017, and then it was reaffirmed in 2025. ACOG states that vaginal seeding should not be performed outside of the context of a research protocol until adequate data on safety and benefit are available. ACOG's primary concerns are the potential transmission of infections like group B strep, the herpes simplex virus, and other pathogens. If vaginal seeding is something that you're curious about or that you want to pursue, you can likely expect some pushback from your care provider because most doctors and most hospitals will follow ACOG's recommendation. Regardless of how your baby is born, there are evidence-based ways to support their microbiome. The top 2 things you can do right away are skin-to-skin contact and breastfeeding. Both of those transfer beneficial bacteria from you to your baby. And these are options that are available to every mother, whether or not vaginal seeding is part of your plan. A gentle cesarean can potentially improve how you experience your birth. And this matters more than it may seem. A 2026 study found that over 1 in 4 women who had an unscheduled cesarean experienced clinically significant acute stress, and those stress responses predicted later PTSD symptoms, depression, and difficulties with maternal-infant bonding. How you experience your birth has a real measurable consequence for your well-being and for your relationship with your baby. A trial at a hospital in Germany compared traditional cesarean birth to a modified cesarean with immediate skin-to-skin. Women in the modified group rated their birth experiences significantly higher than those in the standard group. A randomized controlled trial conducted in the United States, this was the first U.S.-based randomized trial on family-centered cesareans, and it found that family-centered cesareans were significantly associated with earlier skin-to-skin contact, with no differences in maternal or newborn complication rates. Studies have also identified higher breastfeeding rates and improved patient satisfaction with family-centered cesareans. If a gentle cesarean can help more mothers reflect on their birth as a positive experience rather than a traumatic one, that's a meaningful outcome. These modifications aren't about making the surgery feel luxurious or feel like it's not a surgery. They're about preserving the emotional significance of the moment that your baby enters the world. Not every cesarean can include all of the elements of a gentle cesarean. In a true emergency, the priority is on getting your baby out safely and quickly. There may not be time for something like a slower delivery, a clear drape, or immediate skin-to-skin. If your baby needs medical attention immediately after birth, then they may need to go to your care team before going to you. That said, even in urgent situations, some elements of a gentle cesarean can still be preserved. Low barrier modifications like playing your own music, having your partner present, typically remain possible. Your partner can do skin to skin if you cannot. And then once the immediate urgency has passed, delaying things like bathing or weighing your baby can still be honored. The elements that require the most coordination, like a slower delivery, a clear drape, are the ones that are most likely to be set aside in an emergency. Ask your care provider ahead of time which elements they can accommodate in different scenarios so that you're not caught off guard. Gentle cesareans are becoming more common, but they're not yet standard practice at every hospital. Getting hospitals to change their routines is a big obstacle. An article in the Journal of the American Board of Family Medicine documented how one U.S. hospital implemented gentle cesareans. And this required a lot of coordination. They needed input from multiple departments. They had to revise protocols. They had to retrain all medical staff. The anesthesia department had concerns about equipment positioning and access. Neonatal caregivers worried about newborn hypothermia in cooler operating rooms. When the hospital examined outcomes, complication rates for gentle cesareans were similar to or lower than those for traditional cesareans. They also found that offering a more family-centered cesarean actually attracted more mothers to their hospital, even those who were planning a vaginal birth. It's also worth noting that a gentle cesarean typically doesn't cost more than a standard cesarean. Everything we're talking about today is just a modification to an existing procedure. It's not an additional procedure. Implementing a gentle cesarean requires more than just a willing doctor. It involves changing established protocols, retraining staff, sometimes rethinking how operating rooms are set up. And even when the evidence supports a practice, if it adds time to a procedure or it requires additional coordination, hospitals may resist. ORs run on very tight schedules, and a change that slows things down, even by a few minutes, has implications for staffing, costs, the number of procedures that a hospital can perform in a day. As an example, skin to skin during cesarean adds roughly 5 minutes to the operating time. That sounds small, but in a system that's built for efficiency, 5 minutes is a lot. Over time, the hope is that the more mothers that request these adjustments will help to shift the culture at hospitals. The best tool that you have for making a gentle cesarean happen is your birth plan. But we're not talking about just the final piece of paper that you hand to your doctor. Your birth plan is really the process of educating yourself, identifying your preferences, and working with your care provider to make sure that you're aligned well before labor begins or before your procedure begins. If you're planning a vaginal birth, include your gentle cesarean preferences in your backup birth plan. Remember, 1 in 3 babies is born via cesarean. And if you have a backup plan, that's going to give you confidence and autonomy no matter how your birth unfolds. The Pregnancy Podcast has a lot of resources to help you create your birth plan. I will link to all of those in the article for this episode. For a gentle cesarean, your birth plan might include preferences like a clear drape, immediate skin-to-skin in the OR, your choice of music, delayed cord clamping, and which newborn procedures you would like delayed. Start the conversation about a gentle cesarean early in your prenatal care. This is not something that you want to discuss during labor. Ask your care provider what elements your hospital supports and which may face resistance. If your doctor does not typically offer gentle cesareans, you can always ask why. You may find that some of that resistance comes more from not being familiar with it rather than a clinical concern. It's possible that your care provider has concerns about certain elements, and it's important to listen to those. They may help you understand some logistics or risks that you had not considered. And even if you do get some resistance, don't hesitate to advocate for yourself. You and your doctor are a team, and the best birth experience will come from working together throughout your pregnancy. It's not going to come from you handing them a list of requests as you're going into the OR. The number one reason that birth plans fail is that expecting parents do not involve their care provider in the planning process. There's not a magic formula or a single thing that makes a cesarean a gentle cesarean. And there's not one magic thing that will transform this experience for you. It's the combination of small adjustments stacked together. That's what will shift a cesarean from more of a surgical event to an empowering birth experience. A cesarean is major surgery, and there will be aspects of it that are outside of your control. You may not be able to control whether you need one, and you can't control every detail of what happens in the OR. You wouldn't want to. That's why you have professionals there who are taking care of you. You can control more than you may think. And knowing your options, communicating your preferences, working with a care provider that supports you are the tools that help give you that autonomy. That's really the heart of a gentle cesarean. It's about being an active participant in one of the most important moments of your life, rather than feeling like things are happening to you. To recap everything that we talked about in today's episode, we talked about how a gentle cesarean differs from a standard C-section. We went through a lot of modifications that you can make, changes to your birth environment, like music, lighting. We looked at the research beyond why your environment matters. We covered having additional support people in your room, which could include a doula or a photographer. We talked about adjustments to interventions like IVs, monitors, and how your arms are positioned. We went through your option to potentially have a clear drape so that you can see your baby as they're being born. I covered what a slower delivery looks like. We went through a lot of research on skin-to-skin contact, including benefits even if your partner does it, discussed maximizing your time with your baby and which procedures can be delayed, things like delayed cord clamping. We also did a deep dive into vaginal seeding and went through a lot of that research, and talked about some research that connects gentle cesareans to a better birth experience. And then wrapped up with how you can plan and advocate for these options and why your birth plan is still the most important tool that you have. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. If you have a friend who's expecting, please share this podcast. So many listeners discover the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all the resources that accompany this episode at pregnancypodcast.com/gentle cesarean. If you're looking for more evidence-based information, or you just want an ad-free experience, check out Pregnancy Podcast Premium. Premium members get ad-free access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.